I'm the mom of twin 4-year-old girls, Molly and Emma. They are the most amazing children, and I am tired all the time. I am a frontline healthcare provider, and so in March 2020, COVID became a very big thing, and so I think like many healthcare providers, my world was turned upside down in some senses very quickly. That we were trying to figure out what our clinical practice was going to look like, how we were going to keep people safe. And I remember doing actually a palliative care consult with one of my colleagues, and after we did it, we left the room and we reflected like how strange it was to not be able to touch somebody, and that impulse to go put your hands on someone and then pull away, and how strange it was to not, that they couldn't see our faces and we couldn't really see their faces, and just really, it just felt very weird. In the background, about 2 weeks before, I had started noticing that all of a sudden one of my daughters, Molly, had a bump on her head. And she had taken a nosedive out of the crib like the week before that. So we kind of chalked it up to that, although it felt like it was a little strange that we hadn't noticed it before. I emailed the pediatrician. They said, don't worry about it. And so then, seemingly unrelated, a few days later, all of a sudden she had a cough and a fever. And so we were, of course, like, oh my gosh, she has COVID. Got her COVID tested. It was negative. And the fever went away, but the cough didn't. And it was a pretty bad cough. And so, again, emailed the pediatrician, asked if we could come in. And at that point, our pediatrician office, kind of like many others around the country, because she had had some COVID symptoms, they really were not going to able to offer kind of an in-person appointment. And so, the pediatrician and I are going back and forth, and then I noticed some bruising, and so my fears started to go up. And I remember actually probably 3 days before she was diagnosed telling a colleague, I'm that mom that's going crazy because of COVID. I think my child has cancer. And we kind of laughed it off. And Friday morning, she woke up and there were bruises on her legs and she had petechiae. And I just knew. And as part of my job when I was at Dana-Farber, I sat in on hundreds of what we call the day one talk, where families get their child's cancer diagnosis. And so I'd heard hundreds of these stories. And so I just had that feeling. And so again, I called the pediatrician. They said, well, we'll do a virtual visit on Monday. I said, absolutely not. We need it today. So they did. They set me up with a virtual visit. The only appointment they had available was with a resident who was doing the visit from her home. So I kind of am awkwardly trying to point my new webcam down to show them Molly's legs. And I said, do you think this is leukemia? She said, no, I don't think so. And I said, can you just get some labs? And, I work at a small hospital, and she knows who I am, and said, okay, Dr. McCarthy, but you can bring Molly back to daycare. And so I said, okay. So we went and got labs, and I did bring Molly back to daycare, and then I came home and I was on our patient portal just refreshing over and over and over. And I saw her labs and I just started sobbing because I knew. And I went down, I was trying to tell my husband, who was working remotely down in our basement, and he was like, but how do you know? And I was like, I know. And then the phone rang, and it was an oncology fellow saying, you need to come into the hospital. So I went and picked Molly up at daycare, threw some stuff in a bag, picked her up at daycare. I wasn't able to go in to the daycare because of COVID, so I couldn't see Emma, her twin. And just as I was driving away, I kind of had this feeling like, when am I going to see my other child? And so we got to the hospital and she was admitted. At that point, we, like I think probably every other hospital, had very strict visitor policies. There was only one visitor allowed in with the child, and so my husband wasn't able to come in. Next day, they did a bone marrow biopsy, and the first news I got was it was actually pretty good. They came back and said the preliminary pathology is B-cell ALL. If you're going to have cancer, this is a good one to have. Not something anybody should ever say. And people didn't really know, though, what to make of the bump on her head. And so sometime that afternoon or evening, they said, well, let's just get a CT just to make sure, because it didn't really perfectly fit with the leukemia diagnosis. So we did, and it looked like a mass. And then, again, people didn't know what to make of it. So all different things were thrown out. Maybe it's AML, maybe she has a brain tumor. And so nobody knew what was going on. And so at that point, I started calling my colleagues at Dana-Farber. And again, because of COVID, it was difficult to get all the different services she needed lined up. And people were working round the clock to try to coordinate the port placement so she could start treatment. Luckily, her leukemia was caught extraordinarily early, so it was not kind of that usual rush that we have. And the oncologist that was on that first week just had a gut feeling that something was really off. And so he really kind of slowed down the process so he could be very thoughtful about getting all the different tests lined up that he wanted. And I, of course, was like, come on, let's go, let's start treatment. And he held me off. And so on Wednesday, they did as part of kind of her whole, a day-long procedure process under anesthesia, they did a brain and spine MRI. And at about 2 o'clock, the surgeon came up and said, I just have to let you know, there was a weird incidental finding on her spine MRI. And I said, okay. And she said, there's a tumor on her adrenal gland. And so I worked in solid tumors for 4 years. And so I said, is it neuroblastoma? And she said, it's tiny, there's nothing else in her abdomen, it really doesn't look like it. We'll just have to wait and see what the pathology from the biopsy of her head shows. And so next day, they decided to do an abdominal CT. And again, at that point, people had really been saying, like, we aren't gonna worry too much about this. The abdominal CT was read as this looks like likely neuroblastoma. And so then I think behind the scenes, things went crazy. There were, I think I asked the oncologist how many emails, probably between Thursday and Saturday, 25 different individuals, oncologists from all over the country, all over the world, weighing in on if this is neuroblastoma, and ALL, how do we deal with this? Can this even happen? They were triple checking the different samples in the lab, but there were no other leukemia patients in our hospital. And on Friday afternoon, we got the final pathology from her tumor on her head that she had neuroblastoma and ALL. And so they wrote an individualized treatment protocol for her that kind of combined the upfront, very conditioning for ALL, but also that was going to give some treatment to the neuroblastoma. They found 2 other patients in the U.S. that had had these 2 tumors co-occur, and so learned from kind of how both of these patients had been treated. They both had some differences with Molly, and then on Saturday night, she started treatment.